Hi guys, welcome to channel Thinkpedia and thank you for watching this video. According to one research, one of the common error which we as a doctor most of the time come across is that we do not examine the patient completely. So here in this video I will describe each and every system how we have to see and what all things one should see in their patient when they are admitted in the ICU. Before examining the patient, also have a habit of looking the charts and monitor and trend which was there in previous few hours also to be looked, and decision, it helps in making decisions. Introduce yourself to the child, try to be friendly with the child, and then start examining the patient. So no particular way of examination is there, but here in this video I will tell you each and every system how do we examine or what we are supposed to see in those patients. First is cardiovascular system. So in cardiovascular system we look for the trend of heart rate, rhythm, if there are arrhythmias. Also we look for the trend of mean arterial pressure of previous few hours. Along with that we look for the capillary refill time, peripheries are whether warm or cold. Also in cardiovascular system we look for the adequacy of organ perfusion in form of sensorium is normal or not, urine output is normal or not, unexplained metabolic acidosis, high lactate, all these are markers which suggest poor perfusion of the tissue. So all these things we look into when we are examining the patient with cardio. Also, if the patient is on any inodilator, inotropes, vasopressive or vasoactive agents, then the dosages of those drugs, whether side effects of those drugs are there or not, or the effect what we have desired is achieved or not, or when can we wean. So all those things we look in when we are examining the cardiovascular system. Second is respiratory system. So when we are examining the respiratory system, we look for the ET tube position, we look for it, whether it is secured well, we look for whether it's patent or not, there's no any blockage or anything. Also we look for any change in secretions or not. So that was about the tubes. Also second thing in respiratory system which we look is the what ventilatory settings or the oxygen requirement the patient is on. Whenever we are looking at the ventilatory settings with regard to FR2, what we have adjusted is also we have to see. At chest X-ray we have to see if it was done or whether it is needed. There is no dictum like daily X-ray is needed, or there is nothing like ventilated patient daily X-rays. There is nothing like that. It's always based on the situation of the patient. One important thing which we all should remember is that whether it's a cuff tube or uncuffed tube, there has to be some amount of peritubal leak when there is a pressure of 20 to 25 centimeter of water. So there are devices available which nurses check every shift at least thrice a day, and the pressure should not be more than 25 millimeter of mercury. Third system which we should be looking is central nervous system. So first we look for the sensorium. GCS is an objective calculation of the sensorium, so that we have to see pupillary reactions for any inequality or has to be seen. For painful stimulus, if one wants to, we can put a pressure on the nail bed or supraorbital ridge. So that gives that's a painful stimulation one can give to the patient. Also reduce the dosage of sedation or analgesic drugs, those who are ventilated, to see or assess the neurology of that ventilated patient. And fourth is whether if the patient is on any anticonvulsants or anticonvulsant medication, so the dosages are right or not, if required levels has to be seen or not of those drugs, and important interactions also to be looked after. For example, valproate and meropenem you cannot give together, the levels of valproate goes down, right? So this is about the central nervous system. Fourth is for abdomen examination. So first and foremost is we look for the feel, whether it's a soft or distended, or if there is any tenderness is there or not, so that we see. If there is any gastric aspirate, then what color, what amount has come, if they need a replacement for those that gastric aspirate is also to be looked. Bowel sounds we have to see whether the bowel sounds are there or not, and also other issues like there's vomiting or diarrhea, so that are also to be looked after. Fifth is fluid and electrolyte and the nutrition of the. So intake output of daily has to be seen. Also in patients, cumulative intake output also has to be charted. Cumulative means you have to since admission till date, how much amount of the fluid has gone in and how much has gone out. Insensible losses, we don't chart in that, but that has to be there. Renal indices also are important. The last renal indices are where do they stand. Urine output in ml per kg per hour is important. It's not just 200 ml or 300 ml per kg per hour of last 6 hours gives you a rough idea about the renal function as well as your hemodynamic condition. So this is about fluid. Also nutrition. Nutrition, how much protein, calorie are going on and whether it's meeting the requirement of that particular child. So this is about this. 6 is infectious disease related issues. So whether any septic focus is there or not. So whether it needs debridement or any source control is needed or not. Also what antibiotics the child is on, dosages, route and everything is correct or not. Culture reports has to be traced and seen whether and antibiotic de-escalation if possible or adjustment or change on antibiotics if needed based on the culture reports should be looked after. Hematological issues, whether there are any bleeding or any coagulopathy happening inside the body, that has to be seen and addressed. It should not be missed. Then limbs and skin, so whether any extravasation of IV access site or many compartment syndrome happening or those bed sores in the prolonged immobilized patients should daily be inspected by the consultant. And last end is the invasive devices and implants. So whatever invasive devices are there, whether number of days, since how many days that particular device is there, one. Also the site of that device, for example if central line is there, so site of the insertion, whether there is any induration, erythema, pus discharge is there or not, then you have to take the measures accordingly. Also need for that particular invasive device has to be checked daily. Unnecessary or prolonged keeping those foreign material inside can be a source of nosocomial infection and which can increase the hospital stay cost as well as at times mortality is also increased. So this was in brief about what all we should be examining in patient once they are in ICU. If you have any suggestions or if I have missed anything, you're always welcome to share that in the comments below. Thank you.